Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Lagos State Commissioner for Health says residents may be required to take a booster COVID-19 shot for extra protection against the virus. Association of Medical Laboratory Scientists expresses concern over issuance of fake COVID-19 certificates, asks federal government to clamp down on quacks. An MP report criticizes UK's initial response to the COVID-19 outbreak. The World Health Organization, WHO, has recommended that immune-compromised people be given an additional dose of the COVID-19 vaccine. WHO's Strategic Advisory Group of Experts on Immunization said the additional dose should be administered as part of an extended primary series, since these individuals are less likely to respond adequately to vaccination following a standard primary vaccine series and are at high risk of severe COVID-19 disease. Meanwhile, the Nigeria Center for Disease Control, NCDC, reported 284 new cases in 19 states and the Federal Capital Territory. This time, the FCT topped the list of infections with 67 cases, followed by Kaduna with 33 and Rivers with 31 cases each. Let's take a look at the breakdown.
Face masks remain part of the measures to suppress transmission and achieve an adequate level of protection against COVID-19. The NCDC is asking Nigerians to ensure that face masks are worn to all public settings while adhering to other non-pharmaceutical measures. 284 additional persons in Nigeria have tested positive in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 19 states and the FCT, an increase from the reported figures earlier. FCT logged the highest number with 67 cases, followed by Kaduna with 33. Rivers recorded 31, Anambra had 23, Lagos and Osun State recorded 22 each, Cross River and Edo logged 18 cases each, Ondo had 13, while Plateau registered 12. Other states, including Nasarawa, Kwara, Imo, Benue, Niger, Delta, Ekiti, Jigawa, Ogun, and Oyo, registered a single-digit infection rate. The latest data includes a backlog of 101 recoveries from Edo, while Bauchi and Kano did not report any case. The overall count of confirmed cases in Nigeria now stands at 207,978. 352 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 195,626. Lagos is leading the chart of states with the highest number of cases currently on admission, followed by the FCT, Delta, and Oyo. 9 patients have died from complications in the last 24 hours, raising the fatality toll to 2,756. Currently, there are more than 9,000 active cases in Nigeria, while over 3 million samples have been tested so far. More than 5.1 million eligible Nigerians targeted for vaccination have been reached with the first dose, while over 2.4 million persons have been fully vaccinated. The total global confirmed cases have surpassed 238 million, while deaths are beyond 4.8 million.
A COVID-19 booster may be necessary for residents to stay safe from the global pandemic. This is according to the Lagos State Commissioner for Health, Professor Akin Abayomi, who announced this during a briefing ahead of the 7th One Health and Biosecurity Conference. Professor Abayomi says the state government plans to vaccinate 30% of its residents by the end of the year.
You may require a booster, which is a first, second, and then subsequent doses, because we've also discovered that even though the vaccine stops you from getting seriously sick, it may not necessarily stop you from catching COVID. We do know that some people, even who are fully vaccinated with 2 doses, will still catch COVID, and some people, very few, but some people will get quite sick, and occasionally some people may die. But certainly the people that are dying who are not vaccinated are much higher than the people who are dying who have been vaccinated. So we know that the vaccine is certainly protecting populations from severe disease and death. So the question is, as the virus is changing, it may require that we need to give you more than 2 doses. And definitely, scientists around the world are toying with that idea that a 3rd or a 4th dose may be required. Now, that's not very different from the flu. You all know that the flu vaccine needs to be updated every year if you want to protect yourself. So if you got the flu vaccine last year, you need to get another one this year, because every year the flu itself is mutating. And so what you were vaccinated against last year is not going to protect you from this year's flu. So the same thing with COVID-19. It is possible that over time, the original vaccine is not going to be effective against the mutating virus. And so we will need to develop an updated and upgraded vaccine to protect you from the evolving and the mutating strains of COVID-19.
And the Medical Laboratory Science Council of Nigeria is asking all medical laboratory services centers in the country to scale up the quality of service and get accredited by the council or risk being shut down. The Registrar and Chief Executive Officer of the Council, Dr. Tosa Irabo, gave the warning at the meeting with laboratory scientists in Abuja. According to him, medical tourism would become unattractive for many if citizens who are in search of quality diagnosis and treatment can access such services in the country.
The Registrar of the Medical Laboratory Science Council of Nigeria meets with medical laboratory scientists at the Council's headquarters in Abuja. And the crux of the discussions is the need to scale up the quality of laboratory services in the country. The president of the Association of Medical Laboratory Scientists in Nigeria asked the regulatory body to clamp down on substandard medical laboratories.
Laboratories should be accredited so that we now know that anybody that is going there, the cardinal objective is that the patient is safe. The result that is produced there will help the doctor in giving the correct prescription to the patient. And so we are advocating that council should stand. You have a law, you have an act that gives you that statutory responsibility to make sure that laboratories are accredited.
The Registrar of the Medical Laboratory Science Council also addresses a recent concern about inaccurate COVID-19 test results from some of the accredited laboratories in the country.
Approved laboratories speak to standard. Because they don't have those standards, they will not be allowed. And what happens is that some of us, or some of the staff that works in some of these facilities, go out to do 1 or 2 mischiefs, but not directly from those facilities, I assure you, because those facilities will not issue a fake result. And I want to use this method to tell Nigerians, please, if you are going for your COVID test, go to the NCDC network. It's on their website. Check the names of those approved laboratories that are allowed to carry out this COVID test.
The regulator also makes an appeal on the need for governments to make accreditation mandatory for medical laboratories.
MLS is making advocacy to the Federal Ministry of Health on the need for a deliberate policy that makes accreditation civilly mandatory. The management under my watch will continue to rejuvenate the health laboratory diagnostic value to meet the yearnings of the patients.
The council estimates that there are about 10,000 medical laboratories operating in Nigeria, but only 1/3 of these are registered with the council, which makes quackery thrive.
Let's now take a look at how COVID-19 has affected government's decisions, the regional, local impact of the virus crisis, its implications for crisis management and policy responses. Joining us from Abuja studio, Professor Titus Ibekwe, an ENT surgeon and public health physician. Thank you for joining us on the program.
Thank you very much for having me.
Professor, for persons traveling to Nigeria, the rule says proceed on mandatory 7-day self-isolation quarantine, but passengers are advised to avoid physical interaction within that period with friends, family, colleagues, other members of public. How does the port help follow up when we hear reports of some passengers who are absconding?
Yeah, thank you very much. This decision, I believe, was made in good faith to make life a lot easier for travelers and commuters that are coming into our country. Instead of putting them in a particular place, they have the choice of going to designated hotels. But again, authority comes with responsibility. We know that it's very unfortunate that certain adults are not, living up to standard as expected of them. Because if only each and every one of us should be responsible, stating the obvious is that you will see that leaving you to be in designated hotels for specific number of days as a privilege, instead of bringing you to a COVID center, quarantining you there for monitoring for a while or so. That is why a lot of responsibility also lies on the side of the Ports Authority. Surveillance should be carried out in such designated hotels in order to follow up, because we know that mischievous people will only sneak away from their hotels, and if good contact tracing is not done, then the whole effort will be in futility. So the ports regulatory authorities will be able to answer for itself how is able to ensure that they carry out this constant surveillance. But we all know that they have the records of everybody that is entering through our borders, entering through our various airports. Their records are there, including their passports. Ideally, the passport should be kept with the ports authorities within this designated period when they will be under quarantine.
Professor Bekwe,
after that, it will be handed over to them. Yeah.
If we take a closer look,
it's expected that some people should be going there to, do some head count up to date and ensure that compliance is maintained, because compliance is very key here.
Let's take a closer look at the Presidential Steering Committee guidelines that's specific to Turkey, Brazil, and South Africa. One could call them, the red list. For non-passport holders, non-residents who visited those countries, the rule says within 14 days preceding travel, they shall be denied entry into Nigeria, but it doesn't apply to those who transited through those countries. What's your take? Do we need to adjust some of these rules? And this is pending how the curve of the virus looks like on a daily basis.
Yeah, well, as it's usually said, COVID is a disease of nature and nurture, meaning that we must balance the maintaining of good health with also the maintenance of livelihood. If you look at what is happening in the global stage right now, even developed countries like United Kingdom decided to relax on their own restriction, their own red list, that hitherto before now they were hitting up to 52 countries. But as we know, just from yesterday, they dropped from 52 to just 7 countries. And they have been seriously chided to ensure that they look deeper into this. Because this pandemic is global. And even in these so-called red spots, hot countries that have Delta viruses, we know that Delta viruses are also here in the variants are also here in Nigeria. And the argument is that even in some developed countries like United Kingdom, they have much more identified cases compared to our country. But every country is trying to take precautionary measures. I believe that that's why the NCDC rule and the Presidential Committee rule it's putting its searchlight on these countries that have the highest level of Delta variants. But I think the right thing is that it should be reviewed over time, and we know that so many people are getting vaccinated over time. It's just to ensure that our surveillance is very credible and very on. As you rightly pointed, that the post authorities are doing their job to ensure that anybody coming into, whether it's the red hot countries or any other country from outside the country, follows the designated protocols, because it's not marked on the face. Even the countries that are not in the red list, someone can just enter there and come in contact with those with COVID-19. And before you know it, the person is in here, and you'll be thinking that it's coming from a safe zone. So no place is safe. That's the reality. So if we treat every country as being red hot or a red spot, that is what is going to help us, rather than coning down on 3 countries or 4 countries.
We always appreciate your time on the program. Thank you so much, Professor Titus Ibekwe, an ENT surgeon and public health physician. Thank you for joining us on the program.
Thank you, Millicent, for having me.
We have more on the global COVID-19 updates when we return. Please stay with us. Welcome back. U.S. politics may be leading the discussions around COVID-19 mandates, but the pharmaceutical and medical communities are working to end the virus. Our Washington correspondent Maria Bird has more.
Vaccine mandates. A former congressman and current gubernatorial candidate in the state of Texas is hospitalized for COVID, but still doesn't agree with government mandates for COVID-19 vaccinations. While the COVID vaccine discussions continue to be political, many are hopeful that the Delta variant was the last COVID-19 surge in the U.S.
Obviously, different parts of the world are going to be grappling with this on different timetables. But I think in the United States, this Delta wave is probably the last major surge of SARS-CoV-2 infection that we have in the U.S., barring something unexpected happening with the virus. By unexpected, I mean getting a new variant that pierces the immunity that we've acquired from either vaccination or from prior infection. I don't think it's going away. I think we're going to have to do things differently, especially in the wintertime when this virus is going to circulate, in part because it's going to be circulating alongside influenza, and the twin sort of threat from COVID and flu is going to be too great for us to really bear business as usual. We're seeing the national numbers come down, so it looks positive. But really, that's a reflection of the fact that cases are declining very quickly in the South.
The recently developed COVID-19 therapeutic medication by Merck is a bright light for the medical community, as Merck has requested emergency authorization for the usage of the COVID-19 pill. From Washington, Maria Bird, Channel Television News.
And for more on the situation in the U.S., Dr. Abdulaziz Barko, a population health scientist, joins us from Houston, Texas. Thanks for joining us on the program.
Thank you for having me.
All right. Greg Abbott, governor of Texas, has barred all COVID-19 vaccine mandates in the states by any entity as well as private employers. I mean, this is a development that clearly opposes President Biden's vaccine mandates for federal workers. What's your take on the different vaccine mandates we're seeing and its effect on the national numbers?
I think a lot of the times when you have policies that are divergent and conflicting from different entities, government entities, that usually gives a certain setback on ability of governments to be able to control the spread of infections. So in this case, a lot of the problems that have happened in the United States with regards to COVID can be attributed at least partially to some of the divergent and conflicting mandates that have been issued by the state government, federal government, as well as the local or the county government. So going back to your question, I think definitely it will be a setback, and it might lead to some setbacks in terms of the ability of government to take care of the infection.
So perhaps the question is, where lies the solution? Because some are calling the Biden administration demanding private entities imposing the mandates as a sort of federal overreach. And, you know, there's a lot of wonder if this will threaten the achievements, talking about the recovery from the COVID-19 disaster.
Oh, yes. There's some room for that kind of argument that the government is overreaching or something of that nature. But the policy has been in place, or that there has been court mandates or court judgments that have given the government some leeway in terms of its ability to enforce some vaccine mandates. There has been precedent to that. I think there would be a lot of these kinds of back and forth arguments going around, but still the government, I believe, has the right to enact these policies.
Is the Delta variant the last wave or surge of the last COVID infection, do you think, or is it a little too soon?
Well, we all hope so. We do not pray that or hope that there would be another variant of the disease that would be able to overcome the immunity that people have so far gotten from the vaccines and also from previous infections. So hopefully this should be the last, but we should just be cautiously optimistic about these kinds of things.
I'd like to know, with winter on its way, what's your prediction? And this is also with especially how the U.S. is managing the coronavirus situation.
As people continue to get vaccinated, the effect, with the winter period, there would be a lot of people staying together in a closed space much more than in the other seasons, and that might be a recipe for an increasing rate of infection. But I believe with more people getting vaccinated, the impact of the winter period on the vaccine or on the COVID-19 infection rate might not be as bad as we have seen in the past year.
I want to finally get your thoughts. The recently developed COVID-19 therapeutic drug by Merck, what are the prospects for the future under the pandemic?
The drug has been shown to be able to prevent hospitalization for people with mild and moderate COVID-19 infection. So it is a great addition to this sort of set of drugs and vaccines and other methods that we have to be able to control the disease. So I believe that it will certainly help towards taking care of this pandemic and bringing it to an end. So all fingers crossed, we hope that this will be another improvement in terms of our ability to take care of this disease.
Dr. Abdulaziz Bako, Population Health Scientist, always a pleasure. Thanks for joining us on the program.
Thank you for having me.
And a report by MPs in the UK says the country's failure to do more to stop COVID spreading early in the pandemic was one of the worst ever public health failures. Here's more on the global COVID-19 update.
A major report by MPs criticizes the UK's early response to the outbreak, saying big mistakes were made. It says the late lockdown in early 2020 ranks as one of the most important public health failures the UK has ever had. The report also says many thousands of care home deaths could have been avoided. But the MPs commend the vaccine program and rollout as one of the best in the world. Over in Russia, the country has reported 973 pandemic-related deaths, its highest single-day death toll since its start. It also recorded 28,119 new infections in the space of 24 hours. The Kremlin has blamed the rising case numbers on insufficient numbers of people getting vaccinated. Although Russia was fast to develop and launch its Sputnik vaccine when the pandemic struck last year, only around a third of the population have been inoculated. Long queues that last through the night have become a common sight for Indians trying to get a vaccine in one of the country's poorest and remotest districts of West Bengal. Prime Minister Narendra Modi's government has said it aims to inoculate 950 million eligible adults with at least one dose by the end of this year. Around 690 million adults have received their first shot, with vaccine supplies picking up from a sluggish pace in the first half of the year. The World Health Organization says it's awaiting full clinical data on the antiviral pill made by Merck & Co. Incorporated to treat mild to moderate COVID-19 patients. It comes a day after the company said it had applied for U.S. emergency use authorization.
Indeed, this is an interesting development, and we yet have to see the full data about it. If it holds true, then it is another weapon in the fight against the COVID-19 pandemic. And let's not forget all the other weapons we have, and it's always important to remind. So drugs and vaccines are important.
According to data released this month, the drug molnupiravir cut the rate of hospitalization and death by 50% in a trial of mild to moderately ill patients who had at least one risk factor for the disease.
The face mask helps to prevent the spread of COVID-19, protect those around you. Don't forget to wear one when in crowded places. Continue to take responsibility. You can visit our websites for more updates, breaking news on our front page. You can also get an idea, a better understanding of the coronavirus pandemic and other stories. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Nwonga. Stay healthy.